The decision to undergo an operation like a total knee or a total hip replacement is a very personal one. Ultimately, you as the patient are the decision maker, but it is something that we arrive at together. There's a lot of conservative treatment options when it comes to hip or knee arthritis or hip or knee problems, and I think of those as being a progression. The idea being that you don't assume any more risk than is justifiable. Obviously, surgery carries quite a bit of risk with it, which is why we wait until we've done everything short of an operation. Early on, those treatments may be activity modifications. If it hurts when you jog more than 5 miles, you don't jog 5 miles. You change the way that you're doing things so that you can continue to do what you want to do, but you do it in such a manner or such a way that you're not as limited or in as much discomfort or pain from your arthritis. Other things that we talk about would be over-the-counter medications. These would be anti-inflammatories, acetaminophen. Sometimes we talk about braces, sometimes we do injections. There are 3 different flavors of injections that we have now. The most tried and true, the thing that we've been doing for decades now, is steroid injection. Is actually called compound F when they were first doing those injections at the Mayo Clinic where I trained. The next injections are the viscosupplementation injections. Some people think of them as joint lube or the rooster comb injections. The third type of injections are the newest in terms of what's been developed, and those are the biologic injections. Those are the platelet-rich plasma injections, the amniotic injections, a procedure we also do called lipogems here. When all of those things have failed, we're also incorporating strengthening exercises, home programs, physical therapy. But when you get to a point where you've done all of those things and your quality of life is suffering, that's when we have a really serious discussion about joint replacement surgery. And that is when it makes the most sense, when you've done all of those safer, simpler treatments, but your quality of life is still being negatively impacted by your joint, that we then move on towards knee or hip replacement surgery.